Hello, it's my great pleasure to meet the winners from the 2021 annual meeting of the American Society of Cytopathology, presented by the Research and Current Concepts Committee. I am Uma Krishnamurti from Yale University, and I'm joined by my colleague from my committee, Dr. Heather Chen, from the University of Chicago. And this is a three-part series. For part one, we have Dr. Lauren Eversmeyer from the University of California, San Francisco, and Dr. Nalan Yurtsever from the Zucker School of Medicine, Northwell, New York. Dr. Lauren Eversmeyer received the Quality Improvement in Cytology Award for her presentation on spectacular cell blocks, the pullback technique for obtaining core biopsy equivalents. And I now hand it over to Dr. Eversmeyer to present her project.
Okay, hello. Thank you for the introduction. So this project was sort of focusing on a comparison of different techniques for cell blocks. So it was pretty much just a pretty simple thing. We compared something called the pullback method, which avoids rinsing your aspirate back down through the needle versus the needle rinse method that's traditionally used. So we reviewed about 51 cases, half of which were about needle rinse, and then half that were done by the pullback method. And we did this across two different institutions that we have here at UCSF. We scored them for architecture, preservation, the presence of small core fragments, and what was the size of the largest fragment within the cell block. And then an overall core biopsy equivalent score was rendered. But the basic technique was that you pull the aspirate back up into the syringe, take the needle off, set that syringe aside, take a new syringe, and then to make your smears, it's just a little bit of what's in the needle, but the main part of your aspirate is going to be in the tip of the syringe, of the first syringe. And then you wash that out of the syringe nozzle into formalin. And that this would prevent breaking up of your material. So overall, across the different categories, the pullback method scored higher than the needle rinse method, and it was regardless of which type of cell block method was used. We had colloidal bag versus the agar gel. And it just was overall really a pretty simple technique, an effective way to help optimize something that's so precious, which is the cell block material. And that was pretty much the case.
Thank you. That was excellent. I mean, especially now when we have to do so many ancillary techniques on, the cytology specimens to conserve and, optimize our getting material is really important for making an accurate diagnosis and for further studies. So what motivated you to do this project, and what did you find exciting about it?
Yeah, so I guess the main motivation was just across our different institutions that we rotate at, and amongst the many different faculty and cytotechnologists that we work with, the quality of the cell blocks or the amount of material that we were seeing in them was variable, and some had some really great cell blocks pretty consistently. And so it was more of an investigation of how are you collecting your material? What are you doing differently? And then this came back to some attendings were using this pullback method, and most others were using the conventional needle rinse. So we just tried to figure out if there was information or data to support this was actually a better method for collecting. So that kind of just prompted it with seeing the variation. And I don't know, I guess the most exciting part of this was that it was something so simple that it was just a basic look at something that could be improved And did we have a way to do it and collect the data and affect a change or a policy? So I think that was something that would help patient care and was so simple.
All right, great. Well, thanks. So I'm just curious, what were the challenges that you had in terms of completing this project, and how were you able to address them?
For me as a trainee, I was studying for boards and taking boards at the time of like when the whole abstract part was supposed to be submitted. So I think just balancing that clinical work, taking boards, and submitting something of quality to the ASC was probably the biggest challenge at that time.
Great. So I hope you are thinking of writing this up. Will you be submitting it for an publication?
Yes, we will.
Good. We look and you have anything you would want to say to inspire, people applying and submitting abstracts?
Yeah, I guess it's more that what you do for an abstract doesn't necessarily have to be something huge in terms of like project design. It could be something just towards improving quality of patient care. And it could be something simple as just finding something that you feel needs improvement, collecting the data and the information you need to affect a policy change that would help with patient care. So it could be something as simple as this.
Congratulations again for, receiving the award and submitting the abstract, which is great. And thank you for this presentation. I'll now hand it to Dr. Heather Chen.
All right, thank you very much. I am happy to present our next award winner. This is Dr. Nalan Yurtsever, who is the winner of the Warren R. Lang Resident Physician Award with the abstract entitled The Utility of TRPS1 Immunohistochemistry in Diagnosis of Breast Carcinoma in Cytology Specimens. Welcome. Do you mind giving a summary for your presentation?
Sure. Our project has a title of The Utility of TRPS1 Immunohistochemistry in Diagnosis of Breast Carcinoma in Cytology Specimens. Currently, GATA3 is the most frequently used diagnostic marker for breast carcinoma. However, it's not very specific, and we really need a second marker to support the diagnosis for breast carcinoma. And TRPS1 has been established in breast carcinoma, but it was not really evaluated in cytology specimens. So it was our goal to use TRPS1 to evaluate breast cancer in cytology specimens. We gathered all the breast cancer diagnoses from January to October 2020, and we only used the ones that had their hormonal status available. And we also evaluated them for tumor cells, and we used the ones that had at least 20 tumor cells. We used the cell blocks to stain them with TRPS1, GATA3, and SOX10, and we correlated the results with the specimen type. So when we looked at the results, we saw that we divided these breast cancer groups into 3 subgroups: ER/PR positive group, HER2 group, and triple negative breast cancer group. So on our positive, when we look at the first table, we see that all the cases were positive, or the ER/PR cases were positive for both GATA3 and TRPS1. In the HER2 group, 6 cases were positive for TRPS1. All of them were positive for GATA3. In the triple negative breast cancer group, all of them were positive for TRPS1, and only 13 of them were positive for GATA3. And the first table actually shows the intensity of the staining. Now, when we looked at the subgroups, compared them, we see that TRPS1 actually has a significantly lower staining in the HER2 group, but it's compared to GATA3, it's actually much stronger than GATA3 in the triple negative breast cancer group. We also evaluated them by specimen types, but there was really no significant difference between the between the staining pattern between the two groups, butterflies and fine needle aspirations as far as the staining pattern. So we also included some images. On our poster. Just since we have them, I would like to mention them on the right side. The first image is an intramembrane lymph node with triple negative breast cancer. And as you can see, the GATA3 is weak, but TRPS1 and Saxon stains are really strong. The second case is, again, a triple negative breast cancer. GATA3 is stronger, TRPS1 is strong, but Saxon is negative. And the third one is a pleural plate with triple negative breast cancer. With this one, GATA3 is negative, TRPS1 is positive, and Saxon is positive. So the most important data is actually on the table 3 when we compare GATA3 to TRPS1 in triple negative breast cancer. And here we can see that the comparison is significantly significant in favor of TRPS1. Both the intensity and the percentage of staining is higher with TRPS1 compared to GATA3. So in conclusion, we can say that TRPS1 is a more reliable stain compared to GATA3 when we evaluate for breast cancer, and more specifically triple negative breast cancer.
Thank you very much. It's a very interesting project. So what motivated you to work on this project? Are you using this immunohistochemical stain in your breast surgical specimens at your institution?
So we started using it, but the motivation came from this. There was an article in Modern Pathology about TRPS1 staining on surgical specimens. And it was my mentor, Dr. Kuti, who came across this article, and she said, why don't we try this on cytology specimens and see if it works as good as it worked on the surgical specimens? And that's how we started the project. The other reason is in cytology, we come across a lot of specimens that are either carcinoma of unknown origin, or they are specimens from a patient who has history of multiple cancers. So we just try to figure out where it comes from, and breast cancer is a common diagnosis with this one. So we really needed a reliable stain when we were evaluating our specimens in cytology. And this article in Modern Pathology was kind of a lead for us. So that's what we used to design our project and do the same thing with the cytology specimens.
Thank you for the great presentation, but what did you find challenging in accomplishing this project?
I think the number one challenge I had was with statistics, because I'm not really an expert in statistics, and I was using Excel and some online resources to pull the data together and bring out these statistics. And Excel, although it's easy to use, it's really difficult to track if you make a mistake. So I had to double, even triple check that I was coming up with the right result when comparing all these numbers together. And the second challenge was I was pregnant at the time of study, so that I had some unpredictable days, but everything worked out fine.
Well, great. So have you written this up as a manuscript for publication, or are you guys adding more to this project?
So when we did the poster, we did not have the entire GATA immunohistochemistry. We completed that part, and we actually wrote it as a manuscript, and we even submitted to Journal of American Society of Cytopathology.
Great.
Last week we received reviewers' comments, so we are working on the revision.
That sounds great.
Thank you.
That's wonderful that you submitted, and it should come out soon with the revisions. So what would you like to say to inspire other trainees to submit an abstract and everything?
Yeah, so research is really a passion for me, and I really recommend others to share this passion, because we never know. A simple stain like TRPS1 could become a gold standard once, and we could be the leading people for this. And it's really exciting to contribute to such developments and such new scientific findings. I really find it exciting, and I recommend others to be enthusiastic and more involved with these projects.
So again, congratulations for receiving the award, and for, I don't know if your baby's been born yet, so congratulations.
Yes, thank you.
So congratulations on both fronts. And again, thank you so much to both of you for coming here today and presenting and sharing, what motivated you, the challenges you faced, and everything for our viewers.
Yes, thank you. Yes, thank you. It was very interesting to hear, and seeing that you can balance both being a trainee and also your life challenges while also producing great, excellent research work.
So thank you so much.
Great, thank you. Bye.
Welcome to part 2, Meet the Winners, presented by the Research and Current Concept Committee. This will be a 3-part series of all the winners from the 2021 Annual Scientific Meeting.
Hi, my name is Jonas. I'm one of the junior cytologists at Weill Cornell Medicine in New York City, and I have the pleasure of introducing one of our winners today. Ronald Arpin will be presenting on behalf of the group at Massachusetts General Hospital in Boston, their project entitled Thionin Stain Replacement of Toluidine Blue Stain for Cytological Specimen Triage, Improved Safety During the COVID-19 Pandemic, a topic I think is always on the front of our minds these days. Mr. Arpin, would you like to tell us a little bit about your project today?
Sure. Well, back in March of 2020, when the president came out with the emergency pandemic order, we here at Mass General, we actually needed to look at the way we were processing specimens, knowing that we would get an influx of patients that were COVID positive. And back then, we didn't really know how virulent this would be. So the first thing we thought of was that we have specimens that are analyzed in fresh state. And these are particularly body cavity fluids. So in the past, we basically would use a Toluidine blue stain, make a smear with the body cavity fluid, add a drop of T blue. And they do a lot of this in FNA clinics for rapid reads. And then we just cover slip it. And then a cytotechnologist will get called to look for either malignant cells or a really very cellular smear. And with the standard in cytology that really wants you to promote effective measures to prevent cross-contamination, we would monitor this and keep track of these. Very, very little contamination occurs, but to eliminate this, we stain separately. So we were using this T-blue method. If the cytotechnologist saw an abundance of cells or cells that looked malignant, we would put those slides in a separate staining bath to prevent the contamination. And we were actually tracking at one point how accurate we were with this, because the Toluidine blue can be a little bit difficult to decipher. It can blow up the cells, kind of like a diff quick stain. But we're pretty accurate, so we continue this. We've done this for years, but when the pandemic hit, we realized we can't do this anymore. So we decided to research a blue stain that could replace the Toluidine blue. After some research, we found Thionin. And Thionin is a stain that it's actually a part of a process that would include ethanol. And we actually, as a second step, found an alcoholic Thionin stain that adds that extra safety measure for the staining. So it went from just placing the cells on the slide and putting a drop of Toluidine blue to this, some extra steps, which really, it's still a process. It involves 99% isopropanol, which essentially should kill virus. So we're very certain that we were protecting the staff. And the slides and the cells look almost exactly alike for Toluidine blue. So there really was no difference in viewing these and being able to interpret. So part of the our study in the results, we had 13 samples that we evaluated. We got 100% concordance, which we wanted to have. And then 6 of those cases were separated for staining either due to high cellularity or malignant cells. And then 7 were deemed suitable for batch staining, which means they could go with the other cases. So after doing this for about a month, we realized that this was an acceptable method, and we kept it. It was easy to do. We switched the way we did the staining from using water baths in staining dishes, because we'd have to decontaminate them, to actually using a staining plate where we would place the slides horizontally and drop stain and the reagent on top of the slide. And so all we had to really do was decontaminate the plate instead of all these multiple jars. So we really got good results from this. We continue to use this to this day, and I don't think we'll switch back to Toluidine blue, because I think the staff really feels comfortable using this, and they feel comfortable that they're protected.
Oh, that's awesome. I'm Kathy, and I'm also a member of this committee, and I'm the program director at MD Anderson for the cytology program. And I wondered if you can tell us, what was the most exciting or rewarding component of your project?
So I wear many hats here in addition to being the technical director. So I'm the head safety officer. So being the head safety officer, I'm involved in a bunch of different projects in the department to improve safety and efficiency. And this was right up my alley. So it fit the bill, and I felt more comfortable knowing that staff was protected. Back then too, N95 masks were the thing. We had to make sure everyone was completely using those, as uncomfortable as they were. It was nice to switch away from them and go to surgical masks. But this was right up my alley, and something that I was really glad to be a part of.
You know, I remember those early days in the pandemic. They were quite scary. Doing anything in the laboratory was a challenge. Were there any specific, either administrative or academic challenges that you found doing a project at that time in the pandemic?
Honestly, the only real challenge was finding an adequate thionin stain. And I really wanted to find an alcoholic stain. A lot of these you have to mix, they're powdered forms. So that really was the biggest challenge, is finding something that would work. Our cytotechnologists are very experienced here. They had no problem evaluating the new staining method. But really, other than that, it was finding a stain that would work, and I did, and it worked, and it still works.
Great. So you said that you've already implemented this new stain in your lab then, because it was so successful. Do you have any additional, I guess, future plans to do something similar, or to do something more with this particular stain?
I think, like I said, we'll stick with this. We still employ Toluidine blue in the rapid FNA clinic that our cytopathologists attend. They like that, but they're not dealing with specimens that they're pretty much fresh. They're fresh, but we actually had them remove the T blue at that point and try the thionin. It didn't go over that well, because you needed, it added that extra timing. So they really had to make sure that they were well protected, N95, to continue to use the T blue. But the thionin really worked well in the lab, better in the lab. So we'll continue to use this and keep the Toluidine blue as part of another method.
You know, I think it's really remarkable that you were able to do this project during this time. Is there anything about your experience that you think we could generalize, both in terms of the research that you did and in terms of using this method across different laboratories? I think it would be great if we could use it here in New York.
Right. I think you need to really think out of the box. And that's what I always tell people: keep safety as your primary concern. Things can change overnight, as we saw, and you have to be aware and be able to shift gears and try something new. Some things that we try here don't work. So we go back to the old method. But I'm willing to share this with whoever is interested. It's an easy method to perform and an easy method to evaluate.
Well, when you do share it, we, as part of the American Society for Cytopathology, hope you'll do it through JASC, which is our journal.
And if I didn't, Dr. Pittman would not be very happy. She was on this paper with us, so it will be in JASC.
Well, I look forward to reading and maybe even reviewing it. But
Okay.
I think it'll be wonderful to see these results.
Mm-hmm.
Anyway, thank you for sharing your experience.
Welcome.
Thank you.
You're welcome.
Should we move on to the second winner now?
Yes.
All right. So my name is Kathy Bammert, and I'm the program director of the Cytology program at MD Anderson, and I'm also pleased to be a member of this ASC committee. It is my pleasure to introduce Barbara McGaney-Frayne, who submitted a winning poster titled Improving Professionalism for New Graduates of Cytotechnology Programs. And she did that on behalf of or in participation with her team at the Department of Pathology and Laboratory Medicine at Indiana University School of Medicine. So welcome, Barbara, and thank you for taking the time to talk with us today.
Thank you.
I wondered if you would please start out by just telling us a little bit about your poster and what motivated you to work on this project.
Well, we're just interested in what we're observing these days and how our students in recent years have been approaching the workforce, and they're used to a lot of maybe some distance ed learning, doing things on their own time, their own schedule, and it's different to fit into a patient care environment. And sometimes it's different to work with a multi-generational workforce. So we try to replicate that during lab rotation, but we just thought, what can we do to improve their first, foot in the door, their experience when they start in their careers. And so we had our list of the last 10 years worth of employers from the employer and graduate surveys that all of our programs do every year. And we thought maybe they'd be open to us asking a few more questions.
What specifically did you find in the questions that you asked?
Well, the question that I focused on for this poster was, what has been a recent disappointment with a new hire? And I felt that the employers were really passionate about these extra questions because they're used to answering the questions that they do every year for new hires, but these were a little bit different. And clearly it was of interest because we had a 76% return rate, which is really good for any survey on any day. And so I've listed them there, what the greatest disappointments were. And I want to stress a couple of things. One is that not all of these were graduates from Indiana University. The way we phrased the question was sort of new hires in general. So some of those new hires may have come from a different lab and had been there 5 and 10 years. Some of them may have been new graduates. Not all of them were IU graduates. That was just the list that we used to work from. And in addition to that, we did ask more positive questions as well. We did ask what's been a good thing, or what have you noticed, And so that's what I would hope to expand upon with continuing this project. But I did get feedback that everyone can relate to the new hire, who maybe says they can do something, but they really can't do it as well as they said. And then, of course, I think about the graduate interviewing, and you're like, well, of course I can go on rapid assessments. I've been doing this for however many months in my rotations. It's just different to do it in the workforce. And I think it's important for us to all know how things are perceived from the employer standpoint so that we can improve that experience while the students are still in the training programs.
Were there any results that particularly surprised you or that you saw as an opportunity for improvement? Anything that you found exciting or particularly rewarding about asking these specific questions?
Nothing was terribly surprising. I suspect, like every program director and education coordinator, we always kind of look forward to this time of year when we get the results to find out. For example, one recent one was that punching a time clock at the same time every day, 5 days a week, was a novelty for one of the new hires. They struggled with the concept of showing up on time. And I'm thinking, patient care depends upon us being there when we say we're going to be there, if there's a procedure or whatever may be going on. So that's one that we kind of got a kick out of, how the employer crafted that response. I don't think we were terribly surprised by any of these disappointments. It's kind of what we were expecting. And we all know what these new hires and new graduates can be like. Like I said, they're saying one thing to get the job, and then the reality is maybe they're not as strong as maybe their own perception might be. We've got the one who's always too talkative, and then we've got the one who's not talkative enough, And so I think it is of value to look at the list of disappointments so that we can work on that throughout the year, not just this time of year when folks are interviewing and going out into the workforce. The other important piece of it was that I like sharing that with our team of seasoned cytotechs who help train the soon-to-be new grads. And I think there was some reflection within our team, like, gosh, what am I modeling? What behavior am I modeling? And do I contribute to good skills or skills that can be improved? So that was a very interesting outcome of this paper. And it was one of our administrators who helped me get the permission to use that IU Health, the black box that's in figure 3. Please take responsibility for the energy you bring into this space. It was kind of made everybody be a little bit introspective. And the day that it showed up on the door to the lab, it got my attention. And I thought, well, if it gets my attention, maybe it would be good to share with a greater crowd. So I think for all of us, just having an awareness of these shortcomings, and then, like I said, the part B to come, the strengths of new hires, and being willing to listen to new and different ideas, like the previous poster we just discussed. I love the discovery of that. Toluidine blue and Thionin blue are, they've been in our techniques courses for years. How awesome is that to try something new? I also like the idea that sometimes you try something new and it doesn't work. I don't know if the steps that I'm putting in here to help improve professionalism were working yet or not. That's why this does lend itself to a future follow-up. But we're going to definitely put our best foot forward and see if we can help ease that transition from college life into the professional world.
And I really enjoyed your poster, Barb, because, again, as a program director, it's great to hear the things that we do well, but it's really helpful to also discover opportunities for improvement, right? That's how we make our programs and our curriculum better. That's how we better serve the patients. Were there any challenges that you faced while you were working on your project? And if so, how did you address them?
There weren't really too many challenges because it was pretty straightforward. We brainstormed and came up with our list of questions. And then we had a pretty solid list of recent employers that we agreed to send them out to. And the thing that worked really well was this high response rate. That was thrilling to see. And then just the challenge was, okay, how are we going to put this together in a way that is visually pleasing and that readers would get something out of without being too much doom and gloom? Because when I first read it, I thought, oh no. I didn't want that to be the takeaway message. So I think one of the challenges was crafting this in a way that we can put a positive spin on the lesson. It is hard to see these things about some folks that came from our program, but it's also good to look at that and be transparent, and we can all work together to see how we can improve the process.
I think your results are really kind of eye-opening, and I can imagine many different ways that you can take this project. I understand that you did it, during the beginning of the pandemic when things were different than they are now. is there any follow-up or future directions that you are planning for this project?
Well, a couple of things. We do hope to publish it and include the more positive spin, because we also asked a question, tell us some good things about new hires. That was the flip side to this. And then this would include graduates from 2019 and before. So this doesn't really address the difficulties and the struggles of the class of 2020 and the class of 2021 faced when they did have to do a lot of distance ed learning, and some of our laboratory skills were supposed to be done remotely. Well, how do you teach anyone how to go on a rapid assessment or rapid evaluation remotely? You know, that was kind of a crazy thing. And yet we did learn telepathology during that time. It's a nice goal. It's a bullet point, you know, on your objectives list. We didn't just talk about it or demonstrate it. We really did it. So yes, I think there will be some opportunities to share how the pandemic escalated our abilities with distance learning, and then also recognizing where their shortcomings are. Not everything can be done by distance learning.
Well, that's awesome. And I hope that when you actually follow up and do additional studies in those areas, that you'll share them and submit your manuscript to the JASC. We would love that. I would love to see your manuscript.
Fantastic.
Well, I think our time is running short. Maybe we should wrap up. I've really enjoyed hearing from both of you about the projects that you did. It's really exciting to see them, the posters themselves, and to see you at the annual meeting of the JASC, which this year will be joint with the IAC. And I hope many groups, including cytotechnologists, will choose to submit their projects for the meeting.
Thank you both so much. I really enjoyed talking with you today. I'm very excited to have copies of your posters. I'm definitely going to take this back to my students and incorporate it into our curriculum. So we'll have some very exciting discussions because of your work. Thank you so much for sharing it with us.
Yep.
Great.
My pleasure.
Thank you, guys.
Thank
You're
you.
welcome.
Perfect.
All right.
Thank
Take
you.
care.
Thank you guys so much. It was wonderful.
Hello, everyone. Welcome to part 3 of meeting the winners of the 2021 ASC Annual Meeting Abstracts and Paper Awards. This is brought to you by the Research and Current Concepts Committee. I am Sinchita Roy-Chowdhuri from the University of Texas MD Anderson Cancer Center, and I am joined here with my colleague, Diana.
And I'm Dr. Diana Ng. I'm an assistant attending at Memorial Sloan Kettering in New York. In addition to being a cytopathologist, I'm also a global cancer researcher.
So the first presentation we have today is the award for the Jean Sacomono New Frontiers in Cytology Award. The award winner is Dr. Yupeng Gang from the University of California, Los Angeles, and she will be presenting her work on developing a deep learning approach for label-free isolation and enrichment of cancer cells and body fluids for cytological and molecular analysis. Welcome, Yupeng. Would you like to get us started with a little overview of the work that you presented?
Yeah, it's my honor to be here. Thank you for ASC to provide me with this opportunity. So our research project is to develop a deep learning approach for the label-free characterization, isolation, and enrichment of cancer cell in the body fluid that can be used to increase the sensitivity to cytological and molecular analysis. So we use the platform that was developed by DeepCell, which combines microfluidics, high-resolution imaging, and the AI model to morphologically characterize cells. So basically, we prepare single-cell suspension of body fluid, and then we flow the fluid through the microfluidic chip, where the high-resolution bright field image of each cell is taken. Then the AI model will classify the cells as benign or malignant based entirely on their morphologic features and store them into a collection or waste port. This way, we have achieved enrichment of viable and label-free cancer cells, which can be used in a variety of downstream tests, including molecular studies, fish studies, etc.
Well, thank you for the excellent summary. What motivated you to work on this really interesting project?
Yeah, as you know, we're living in the age of personalized medical care, and the molecular and cell genetic studies are very important for detection of therapeutic drugs for cancer treatment. We're also living in the age of minimally invasive procedures, and drinking pleural fluid or ascites is a very easy way to perform and repeat with minimal complications, even in patients that's not physically fit for a biopsy procedure. So this is particularly important in the setting of metastatic cancers from deep organs like ovary, lung, certain parts of GI tract, etc., where tissue from the primary site can be very difficult or sometimes impossible to obtain. Therefore, one of our major motivation for this project is its clinical implications. So I was a cytopathology fellow last year, and I often receive requests from the clinicians to perform molecular studies or fish studies on the fluid specimen. However, this is sometimes difficult to achieve due to the low concentration of the cancer cells in the body fluid, especially after chemotherapy. Therefore, the need for developing a sensitive method for enriching malignant cells in the body fluid to perform molecular studies or fish studies has motivated us to work on this project.
Thank you. I mean, I can see you're very excited by this project, and it seems like it was very rewarding to work on this. Thank you for sharing that. But I also feel like, you know, with any research project, there are challenges that you face. Are there anything specific that you faced, especially because you did this project as a trainee? Did you have any specific challenges that you want to share with our audience in terms of the project that you did?
Yeah, so one of the challenges for us is to select for malignant body fluid and ship the specimen to the testing lab in a timely manner. This sounds simple, but actually it causes a lot of difficulty. Ideally, the specimen should be available for testing within 24 hours from collection to minimize cell degradation. Therefore, we came up with this system that our cytotechnologist would notify us of a positive fluid with sufficient volume when they're screening the slides. And we would expedite the process and therefore ensure the viability of the cancer cell they're testing by the platform when they reach deep cell. So we have to establish a communication, packaging, and shipment system to promptly get the samples to deep cell lab. At Deep Cell, a team of scientists also receive and process the specimen in a very fast response. So this is really a teamwork between UCLA pathologists, cytotechnologists, and the lab staff, and as well as a Deep Cell scientist. And I'm very fortunate to have great support from everyone. The other challenge for me personally is to understand the concept and terminology used in artificial intelligence. It is something that I've always been interested in learning, but never had the opportunity. So with the help from my collaborators, I was able to get a deeper understanding of the field, which I think will benefit me for the future research projects.
I think this project is also unique because of the collaboration with industry. I think there's a lot of discussion about academic industry partnerships, but not often within conferences. So, given this type of academic industry partnership, and also kind of just the applications of this, what are some future directions for your project?
We're continuing to extend the cohort of larger sample size and different type of cancers. So, like training the AI model is like training a pathologist or cytotechnologist. So the more cases it sees, the better it will get to differentiate malignant from benign. So this is something that we'll keep doing. We're also performing molecular studies on the enriched specimen and compare them with the patient's known genetic alterations. Another future direction, which I find very exciting, is to evaluate for cancer clonal heterogeneity. So as you know, carcinoma, especially hybrid, they often have a very heterogeneous morphologic appearance, even within the same specimen. So our goal is to sort the malignant cells from the same patient into different groups based on their morphologic features, and then evaluate for a possible association of certain genetic alterations with the morphologic features.
That is fascinating. I mean, I really want to thank you for sharing your experience. I mean, this obviously highlights to all of our trainees and future trainees how exciting cytologic research can be. And we want to make sure that everybody who is in the field, entering the field and practicing, can take from this experience. So is there anything that you would advise others that are in cytopathology or considering a career in cytopathology, especially based on the project that you did and the direction it's taking?
Right. What I learned from this research experience is the importance of teamwork in research. So the members of our team have a diverse background of knowledge, including pathology, computer science, and lab management. So it's their passion in this scientific community that provides great opportunities for us to learn from each other. I have learned a lot about artificial intelligence from our awesome collaborators from DeepCell. We also receive a lot of help from our molecular pathologists at UCLA and the staff from the labs. I think we would not have achieved such a positive outcome with their help. So I feel like teamwork is definitely what I learned from this, and I would advise others to value when they're doing their research projects.
Yeah, I definitely agree, because team science, I think, is currently a buzzword out there, but I actually think it's really important. But also as a trainee, I'm sure, and myself, when I was a trainee, I benefited from a team of mentors as well. So it seems like you've also benefited with different people who have different types of content expertise, which is really great. So one final thing, I noticed this. You're probably still furiously collecting data and analyzing the data. It hasn't been published yet, but I just want to mention, please consider submitting the project to the Journal of American Society of Cytopathology, or as we call it, JASC. So thank you so much. It was really great to chat with you today.
Thank you.
All right, so I guess we'll move on to Ryan. Okay. So I'd like to introduce Dr. Ryan Glass, who won the Advances in Thyroid Cytology Award for his platform presentation, The Impact of Reflex Molecular Testing on the Management of Indeterminate Thyroid Cytology, a Single Institution Experience. Dr. Ryan Glass is a junior attending at the University of Pittsburgh Medical Center East. So I guess let's just start with having you tell us a little bit about your project.
All right, well, thanks so much for having me. It's great to be here and I'm honored to have received the award. So a little bit about our project. As I'm sure all of you know, thyroid cytology has gone through a lot of changes in the past decade or so. Molecular testing has become much more available, and the number of genes we search for has increased tremendously, which of course can help guide clinicians and surgeons with indeterminate specimens. Additionally, the fact that cases that were formerly called follicular carcinoma or follicular variant are now being called NIFP can, of course, impact your benign call rates. And since a lot of these patients had surgeries, being able to preemptively identify them, if at all possible, could cut back on unnecessary surgeries. So the point of our project was to kind of retrospectively go through data at Dartmouth-Hitchcock, determine how molecular testing has been utilized in the past 5 or 6 years and whether or not that's had an impact on patient management. So this was largely a data mining project. We'd initially gone through gone through the system to find all cases that were diagnosed as Bethesda category 3 or 4. And we also looked to see if they'd had concurrent molecular testing, be it Afirma, Thigenix, Thyromere, or Thyroseq, and also whether or not they'd had partial or total thyroidectomies. So we'd found that probably around 2016, 2017 is when the institution started really ramping up their utilization of molecular testing. Then you could also see them sort of shifting which tests they used, initially Afirma, but we didn't have a whole lot of them, followed by Thigenix, and by now it's predominantly Thyroseq. And what we did find is that while more patients have had molecular testing, there has been a concurrent decrease in the number of surgeries performed here. So we believe that thanks to our implementation of these testings, we have been able to cut back on number of procedures and unnecessary procedures being performed.
Okay, great. Thank you. Thank you for that summary. Yeah, molecular testing for thyroid has really transformed our field, and it's really kind of a nice adjunct ancillary test that we have. So maybe you can tell us, since you started this when you were a trainee, what motivated you to work on this project and kind of answer this question?
Well, largely, but I feel like I've been interested in thyroid cytology even before fellowship, even early on in residency. Like, it had a great mentor, and one of the first things we did as a resident was I published a short paper on NIFP and cytologic findings. Although to be perfectly honest, it was very limited by volume and the fact that this was early 2015, so we didn't have as many molecular tests done on these specimens. But even at the time, I thought it was a pretty cool project. Like you could already see there was some potential for reducing unnecessary surgeries, given that we'd already found some features that seem to correlate better with ones that would be called invasive follicular variant or follicular carcinoma versus NIFP. And now my fellowship at Dartmouth, I'm at a place with a much larger volume with routine molecular testings, about 5 or 6 years into the future, of course. And of course, as luck would have it, one of my attendings approached me pretty early on about this topic, so it just seemed like a great opportunity.
That's wonderful. I mean, obviously your work has had significant impact on patient care. So on a personal level, doing this project, what was the most exciting part of this project? What did you find rewarding? I'm sure our audience here would love to hear your personal experience.
Probably the part where it all came together at the end. I mean, this is a retrospective review, so there's a lot of data mining, which, as anyone will tell you, is incredibly tedious. But at some point, when I've got all the data collected, when we run it through our statistical tests, when we can actually put a number to it, like, this is how many fewer surgeries have happened. These are the molecular alterations we find. This is the impact it's had on patient care. And the fact that there was one, of course, that's what made it worthwhile to me.
Yeah, I definitely agree. Sometimes it's easy to get lost in the road of research, especially, when you feel like you're never going to get there. But when you finally do get there, it's so rewarding.
Exactly.
So, there's a light at the end of the tunnel. But kind of speaking to that long road, can you tell us about what some of the challenges that you faced, and then how you potentially address them?
Well, a few challenges, I guess, early on, especially in the beginning months of the fellowship. I don't think I was as well versed in Cyto as the attending, so I had to depend on them for a lot of answers. But this is something that definitely improved later on. Another one was just the time commitment. Data mining could take hours on end, but luckily, the fellowship at Dartmouth Hitchcock has 2 dedicated research weeks, which I was used to get this whole project together. And that's another one was the fact that I had to leave before it was even finished. Like right after we submitted, before I had to give the platform. So it was just a question of this additional challenge of making sure that all the data was accessible, all the photos that I might or might not need would already be there, and that if I ever had to go back, someone else would be able to figure out how to do that. And that took a bit of foresight, but we got there.
Yeah, I mean, that kind of like highlights some of the things that I think we all need to pay attention to, like, staying organized and kind of planning and having all our ducks in a row, because there's a definite challenges, especially if you're moving to a new institution. So, your project is primarily an institutional experience. And so I'm kind of curious, given, the impact it has on patient care, do you see reflex testing for all indeterminate thyroid cytology kind of becoming the norm in all practices across different practices? Because there are definitely some challenges to having that, access to testing, and, the logistics of having a send out testing. Can you comment a little bit about, some of the future directions that you foresee that came out of your project, where you see things heading?
I mean, it's kind of hard to say whether or not I think it'll be universal. I think it is definitely growing, though. One of the things we realized during the project was, well, of course, Dartmouth is a major health institution that's sort of acquiring a lot of local hospitals and smaller practices. And we found some variation in adopting the molecular testings or switching to the molecular testings that had to do with, maybe some clinic in one of the small towns doesn't do it yet, or still does one of the older tests, while generally they were trying to adopt more universal ThyroSeq. When I feel like when more things are incorporated under these umbrellas, which is of course for better or worse, that molecular testing will be more streamlined and utilized. As far as my research goes, there was talk about like in collaboration with other institutions. Nothing's happened yet. Actually, one of the new first-year residents at Dartmouth is actually using some of my data to focus primarily on Hürthle cell lesions, or AUS specimens that are called on the basis of Hürthle cells, and that abstract was just submitted. So I guess we'll see what happens.
Yeah, it's definitely true. It's hard to extrapolate too much from a single institutional experience, but I think reporting on one institution and then, as you mentioned, the next step would be a multi-institutional, I guess, evaluation with different types of medical centers and care facilities. So like you said, community hospitals, academic centers, et cetera. It seems like, you've already touched on this, but actually I wanted to ask you, what did you learn from this experience? It sounds like this fellowship was very different from your residency experience. And now as an attending, this definitely has impacted how you practice. Maybe you can tell us a little bit about what you learned.
What I've learned, well, I think as Yipeng said, teamwork is incredibly important. Like, I was so lucky that I would work well with that I could work well with the attending statistician, the surgeons. And I think that's what made the project go so smoothly. Another thing for research, decide what data you want in advance. You never want to have to revisit every single chart. So be organized, plan ahead. Definitely try to be familiar with your information system. It helps with the data mining. If at all possible, get a programmer on board. It cuts down on data mining time a lot. And this, it's hard to say what impact it's had on me as an attending right now. It's, how do I think about it? I still feel like I do. Yeah, I guess I'm just not sure. Like it's like sometimes it's nice to just go back, think about my findings, especially the molecular section. Go, oh, this case has copy numbers. Just like all those cases I looked up in the past that turned out to be carcinoma. Wonder what this will be like. Yeah, something like that.
Yeah, I feel like, every research project is like a learning experience, and you always take away something that you can use in the future, even if it's not specifically the project, but just like you mentioned, the organization skills, looking up, the data mining part, which is tedious, and you definitely don't want to have to go back and revisit that and redo that. So those are really important take-home messages, and I'm sure like anyone listening to this, if there's one thing that they're going to take out of that message is to kind of stay organized and kind of have that goal in sight and not to give up and get disheartened. So it's a long journey, but it's totally worth it. And kind of like, I see that you have already written up your findings and submitted, and it was recently published in JASC. So thank you for submitting your work to JASC. We are totally appreciative of that, and keep us in mind for all of your future projects. We look forward to seeing multiple other projects coming from you. So thank you for sharing your experience. I think this has been very, very, very helpful to our audience, and all of us here on the Research and Current Concepts Committee. Thank you both for your time and sharing your experiences with us.
Thank you.
Congratulations again.